And why are we all here today? Because we want that particular aesthetic practice. We want to have our winning patients, our patients coming back every week, and then we want them to bring their friends along. So, what encompasses an ideal aesthetic practice? Now, if you will look at all the aesthetic clinics, successful aesthetic clinics in your country and even in my country, of course, patients' comfort. And the main thing regarding patients' comfort and the main concern that I get in my clinic every day is the same question they ask me, doctor, will this be painful? It is a very, very normal question. Before I do any toxin injections and filler injections, they always ask me, doctor, will this hurt? And I realized by minimizing pain, I can actually maximize patients' comfort level. So that's why I'm here today. I'm here to share with you a way that we can actually minimize the patient's pain. In your arsenal, back in your clinic, there are a lot of ways that you can minimize patients' pain. You can minimize pain through chemicals, lidocaine, urocaine, petrocaine injections. You can minimize pain through topical, amla cream 5%, lidocaine cream 10%. You can minimize pain through physical as well, through distraction. What I do in my clinic, we tap the forehead while we do an injection to distract the patient from the pain. And the last way to minimize pain is through mechanical. What is mechanical? I'm sure all of you have heard of miso guns. A miso gun is actually a device to help you minimize the pain when you give an injection and also control how much solution that you give. But miso guns do not come cheap. In Kuala Lumpur, a regular miso gun, a basic miso gun costs $5,000 up to $15,000 to $20,000 for a miso gun. And if you are just starting out your own aesthetic practice, how can you afford to put $20,000 into a miso gun while you have other overheads? What I'm here to share with you today on dermatology. First, for cosmetic surgery for wrinkle reduction. BTA. It is not, for BTA, it is not replace the regular needle, the regular single needle when you inject at a particular site. But we usually use it for meso BTA. That means we want to deliver very low dose BTA throughout the entire face. And in my practice, we do a lot of liquid plasma, PRP. In the States, it's a trademark as the vampire lift. We do a lot of PRP and we realize that intradermal PRP actually gives facial rejuvenation. For moisture retention, facelift, hair growth. As we all know, the scalp is very, very dense. There's a lot of fibrous tissue in the scalp. And if we were to introduce just a regular needle, a 27 gauge needle into the scalp, it is painful no matter what we do. In my practice, I've tried using DLT creams, amla, we have done nerve blocks, but yet the patient still feels a high rate of pain and discomfort. It can be used for hyperhidrosis and alopecia as well. So what is this miracle needle? What is this special thing? As you can see, it's for neck lift, treatment of hyperhidrosis, and as well as hair loss treatment. It's just a different needle than what you have in your practice currently. If you look, right up here, there are 3 tips at the end of the needle. 3 tips, and every needle and every device comes with these 3 tips. And whenever you push the plunger on your syringe, 1/3 will come from this needle, 1/3 from this needle, and last third from the other needle. So it gives you a very uniform injection throughout. And if you have a look down here, the needle is designed in such a way It will prevent over-injection, and it prevents the needle from going too deep. So I will always tell my peers, this needle is a combination of a dermal roller, a dermal stab, and as well as a regular needle. It comes in two sizes, 31 gauge and 34 gauge. So why is this needle different than the regular needle that you have in the clinic? The reason why this needle is different is this. We understand pain. We understand that there are a lot of ways that we can do to actually minimize pain through lidocaine, through MLR, etc. But a lot of us doctors, we don't understand that the pain experienced by your patient, by your client, yes, they experience the stick pain when the needle goes in, but most of the pain comes from the volume expansion in the dermis, because we cannot numb the pressure receptors. So the more fluid, the more mesotherapy or the more injectables that you give at a particular area, the more pain that your patient will feel. So what this needle does, it distributes the pressure in the skin. As you can see, the top here is a regular commercial available 4 gauge single needle, and this is the pressure. But you can see at the bottom here, the next is the 34 gauge needle, and of course the one of the lowest pressure is the 31 gauge needle. So you can see that the 34 gauge needle provides 2 times less pressure, and the 31 gauge needle provides 3 times reduced resistance when compared to the regular 34 gauge needle. So next up, comparison of stick pain. But this comparison was done without putting any lidocaine cream or any topical anesthesia. On a scale of 0 to 10, 0 being no pain at all and 10 being the most pain, a conventional 30 gauge needle shows a pain score of an average 4 to 7. So it's an average of about 5.5 or 5.5. But for the PASKIN 34 gauge, shows a range of 0 to 6 with an average of 2.3. So just a simple application, just by changing your needle, you can reduce a patient's pain score by half. And this is a case study done in Fukuoka University in Japan. So what are the benefits of these 3 needles? First of all, it allows a constant insertion depth regardless of practitioner skills. It is useful for new practitioners or experienced practitioners. In my center, I even train my clinical assistants to give the injections because you cannot go beyond the depth which the needle has provided. If you are using a 1.5mm needle, you cannot go beyond that, no matter how hard you press on it. So it will prevent you from injuring or from penetrating certain important structures, nerves, blood vessels, etc. Second of all, minimal pain. It's designed to be fine and sharp. My own personal experience, I do a lot of PRP in my center. 30% of my aesthetic procedures are actually PRP injections. And I use only a single needle for one patient for an entire face. So there's no need to change needles halfway through the procedure. You use the same needle, use it, and you inject the entire face. Because of this, you can actually minimize the cost. And as a practitioner and as a doctor, I do not want to pass a high cost to my patient. I want to be able to charge a cheaper price for them so that they can actually come back over and over again. So cost is a factor. And last of all, broad and shallow fluid delivery. You can distribute the solution shallower, broader, means lesser medication is used. You can save on your VTA, you can save on PRP. There's no need to use too many kits. And you can deliver the same result or even better. So over here, it is the different length, 31 gauge and 34 gauge. Alright, this is the needle gauge and as well as the 1.5, 2.5, and 3.5 mm. And my personal favorite is 31 gauge 2.5 mm, because it allows me to finish the mesotherapy fast. An average time for me to do a mesotherapy with a conventional 34 gauge needle will take me about 15 to 20 minutes for a face, per face. An average time when I use this particular needle only takes me less than 10 minutes. Imagine you can finish the session faster, patient has lesser pain, and then you can then move on to your next patient. The turnover time will be dramatically reduced. Because of that, you can perform more therapies, and then generate more cash for your clinic. Okay, next up, I'm going to show you a video. It was taken just a few days ago. It's actually a video of me using the needle for the PRP. Now this patient is a female. The reason for the PRP is mainly for skin rejuvenation and for scar revision. She's currently on certain supplements and as well as on oral contraceptives. So if I were to use a conventional needle, she will be fine with it. So while doing the injection, I would like you to focus on this. Every time I do an injection, there is a small wheal that appears on the forehead. It means that you have injected enough and then move on. And yet, as you can see, I do it very, very slowly. The patient is very, very comfortable. There is almost no bleeding. This is on the side, and this is with active acne. This is a 2.5 millimeter. And every injection, the depth is the same. It's 2.5 millimeters. It does not go any deeper. It does not go any shallower. This is just a regular syringe that I use. It's a 3cc lower lock syringe, available anywhere in the clinic, definitely. All you need to do is just to attach the needle to the end of the syringe. Very, very low cost. So as you can see, this is directly after the procedure is done. There is a little bit of redness, definitely. After cleaning up the face, you can even hardly see the puncture wounds. The patient can just walk out of the door, go on with the shopping, go on with their daily life. When I discovered this needle earlier this year in a AAAAM conference in Singapore, I was initially skeptical as well. But the moment I started using it, I realized how easy it was to actually use the needle, how painless it is for my clients, and they love it. They come back time and time again, and they're no longer afraid of needles. You can even do the same in your practice. This is a very, very low setup cost. What I usually recommend for you to do in your practice is this. I want you to divide the forehead into half. One side, you use a conventional 34 gauge needle, and the other side, you use the 3 needle 34 gauge. And then as you inject on one side of the forehead, you ask the patient for the pain score. When you inject the other side of the forehead, again you ask the patient for their pain score. And you will be surprised. You will be surprised that sometimes patients don't even know they've already done an injection on the side where you actually use the 3 needles. This is no substitute for a meso gun. Definitely it's not a substitute for a meso gun. But this allows you to do something in your clinical setup which does not require a very high investment. So if you're actually looking for a practice where your waiting rooms are always full, where telephone lines ring off the phone because patients want to make appointments documents again and again, or when your client comes back every month to sign a new package,